My name is Miguel Prudêncio and my research focuses on the study of malaria, an infectious disease that still kills more than 500,000 children every year and that primarily affects some of the poorest regions of the globe. And our work focuses mainly on the development of drugs to combat this disease and vaccines to prevent malaria. So our work focuses mainly on the identification of new drugs to combat malaria and on the development of vaccines against this infectious disease. And we use mice if and when there are no alternatives for our research. So specifically, we use these mice to assess the anti-malarial activity of specific compounds in an organism and also to preclinically evaluate vaccine candidates that we develop in the laboratory. We, of course, use non-animal methods whenever these are available. For example, we use in vitro systems to assess compounds that may have antiplasmodial activity. But then there is a stage of our research that demands the use of animals because we cannot recapitulate the complexity of an organism inside a petri dish or a cell plate. And this is more so when it comes to vaccines, because vaccines elicit an immune response that is extremely complex with multiple cell types, multiple organs involved, and we simply cannot recapitulate that complexity in vitro, and we need a full organism in order to assess these vaccines preclinically. So my two rules about communicating scientific matters to general audiences are the following. The first one is, to the best of my knowledge, to always be transparent and honest and scientifically accurate about what I am saying. And the second one is to try and understand who my audience is and what are their doubts, their anxieties, the questions they may have, and then try to adapt my language to suit those needs. So I avoid, for example, scientific jargon, and I try to use language that can be easily understood by my audience. This is what I tried to do during the COVID-19 pandemic, when I was asked to be in the media several times to relate information about COVID-19 vaccines and vaccination, and I always tried to follow these two rules during those interactions. Well, I think it is important for two main reasons. The first one is because as scientists, we work in a society that is also, in some cases, responsible for our funding through taxes and through publicly funded research. So we have a duty to return to society the information that is relevant for them to understand what we are doing. The second reason I find extremely important is because transparency and openness about these matters is the only way to combat disinformation and misinformation. If we don't talk about our research openly, then we leave the door open for a narrative to be established by groups and by people that aim at misinforming and disinforming, even if they don't do it willingly. We need to fill that space with accurate and transparent information to avoid that risk.